Liv, it's great to see you and so thrilled to hear about this exciting talk you will be giving. Tell me more about your research. Tell me more about the microbiome and transplant and sort of what's new, where we are, and tell me about your work.
Thanks, Camille. I'm delighted to be chatting with you. Thanks for having me. Um, I think I think the microbiome is a really exciting new frontier in medicine. We know our bodies are inhabited by trillions of bacteria and viruses, archaea, and fungi, but until relatively recently, we've known little about how they interact with us. And it turns out we're in a really intimate bi-directional relationship with the organisms that colonize us as part of the microbiome, and we have been since birth. And the balance of that interaction is really critical for our health and well-being. And when there is imbalance in this relationship, that has basically been associated with every human disease described. And I think what's really exciting is in transplant, we know the case is the same. And theoretically, the microbiome may be especially important in the setting of transplantation because we know that the bugs that inhabit us influence the way our immune system responds. And obviously, our immune system response is critical for how a graft survives. So it may well be that despite all of the advances that we've made in transplantation, looking for opportunities to improve outcomes for our patients, it may be right under our nose, in our guts, so to speak, that the bugs may be a whole new frontier to offer new opportunities for diagnostics and treatments for our patients. So I think that's a really exciting development. The work that I've been doing as part of my PhD, which will hopefully be completed and published by the time TTS rolls around, is trying to tease out that association a little bit more in the setting of solid organ transplantation, particularly in the setting of liver transplant. So, what I've been doing is collecting stool samples across the transplant journey from before, during, and after, as well as sampling the host immune system and trying to identify exact ways in which that interaction occurs that may signal complications, particularly infection after transplant, that may highlight a new opportunity or way to predict and prevent those infections from occurring.
Wow, that sounds amazing. This has been such sought after information, but challenging to figure out and requires certainly a huge amount of data manipulation. So sounds like now is the time to be cracking this important topic. Um, so so interesting. Can't wait to read your article once it's published. Um, how how close are we to using this data in real-time clinical practice? Is this something you're doing in Australia?
Yeah, great question. I think we're really not at the point of routine clinical implementation yet, and we really need a lot of answers to quite a few challenging questions in the setting of microbiome before we will be ready to do so. We really lack standardization in sequencing methods, access to really fast turnaround times and very clear time points at which we would integrate the microbiome into clinical workflows before we'll be ready to sort of bring that to prime time on the patient bedside. I think we also need a bit more data that's really robust and multi-centered to sort of demonstrate exactly how the microbiome does what we think it might be doing. But having said that, I think the trajectory of change over the last decade or so is really very encouraging, and our predictive modeling and computational techniques are fast approaching. The cost of sequencing is coming down, making this testing more available. And I think we're really starting to tease out some consistent signals of adverse outcomes across diverse transplant populations. So, for example, expansion of Enterococcus has really sort of been borne out across a number of cohorts as a predictor of subsequent infection. And I think that's really important before we can translate these findings to the real time. But I would say we're really in a transition phase, moving from description to clinically actionable risk stratification. And the science is advancing quickly, but we need to be careful before we jump to bringing it to the bedside.
Agreed. I've heard that some companies are offering some types of microbiome analysis. Is that what are your thoughts on that? These companies that are sort of doing this in the commercial context and it's fairly pricey. Is that something you would recommend for transplant patients at this point?
Really great question. And I'm sure in Australia, we're not the only country where this is happening, where the barriers to accessing this sort of testing are becoming lower and lower. I think the challenge is we really don't know enough about the microbiome, how it behaves, and how to use it as a prediction tool or a target for modification to really be able to make meaningful recommendations for our patients. And the information that is delivered from these reports can sometimes be multi-page, the taxonomic composition of 40 different organisms in your gut, disentangling what that means for a patient given that there can be variability from day to day in the composition of your gut microbiome, is really unclear. So I think at this point in time, it probably creates more confusion than clarity for patients and for clinicians trying to wade through that information. So again, I would really suggest that we're in an exciting phase where I think the microbiome is on the future, but there is quite a bit more information we need before we're ready for prime time for our patients.
Yes, sounds good. I would agree, but that's a good heads up, especially for people that might be thinking that they would be spending money on that information when it's not quite decipherable yet. What about things like, does
Yep.
this change your practice around antibiotic use in this population? Is that something that you influences your day-to-day clinical care, which I know is so excellent?
Yeah, thanks, Camille. I think that's right. And I think being an infectious diseases physician where, uniquely positioned, thinking about stewardship and really trying to carefully curate the antibiotic choices that we make, that I think the data emerging from the microbiome field is really giving us even more information to justify those choices. I think probably the biggest, broadest, easiest aspect of the microbiome to think about is the collection of our healthy bugs are represented really by what we call anaerobic species that reside in the gut that are particularly going to be influenced by antibiotics with an anaerobic spectrum. And there's, quite large population cross-sectional studies that sort of support that when we lose our healthy anaerobic bacteria in the gut, that can be associated with adverse health outcomes, including infection risk. So I think in particular, the way I'm thinking about this is what are the opportunities that I can steward or narrow the spectrum of my antibiotics with narrowing the spectrum of anaerobic activity of my antibiotics in particular, knowing that they will have a disproportionate impact on our healthy species. Because the flow on from that, and there's a lot of preclinical work to support this, is when we lose our healthy anaerobic species, they are what we call our colonization resistance. So the organisms that help prevent us become overcolonized with potentially harmful bacteria like VRE, carbapenemase resistant organisms, ESBL carrying gram negatives. So when we lose our healthy bugs, that creates an opportunity or a niche for the bad bugs to take over, which can then be associated with even more complications. So I think we don't have microbiome markers, successfully or realistically yet incorporated as endpoints into trials, but I think that would be really useful because I think that's probably going to be an uh, an untold consequence that's really worth powering our studies to microbiome endpoints. But again, we're not there yet, and so I think just some general principles for narrowing spectrum, particularly with an anaerobic spectrum, is worthwhile.
So interesting. And we've long thought that anaerobes are really important for us and that concept of colonization resistance, but now you're really applying some hardcore science to it. So that is great to see in our field. In transplant, we often talk about the ultimate transplant, which is a fecal transplant, not necessarily an organ per se. But how do you think fecal transplants will influence your work with the microbiome, and what does that look like to you? I know that's super complicated.
I mean, it's a great question. And I think, again, fecal transplants are becoming increasingly more mainstream, but I tend to think of them as part of a suite of sort of microbiome targeted or restorative therapies, which include, a number of interventions to restore a healthy population in the gut. I think FMT is one of those, and others include, prebiotics or postbiotics, other microbial therapeutics, and probably maybe the most underexplored, but will be the most difficult to tease out and study the effects of, but potentially the cheapest, are things like dietary modulation and optimization, which I think, potentially the cheapest and easiest thing we could offer our patients of all, and potentially the most sustainable and enduring because patients can implement dietary modifications, but perhaps one of the most challenging and maybe even less sexy to study. But I think there's some good evidence, particularly in the setting of allogeneic stem cell transplant, that oral therapy and dietary modifications really can have meaningful impacts on, the foods we eat are the substrates that feed our gut bugs. And so if you're feeding your gut bugs the right food and the right substrates, the right healthy bugs are more likely to flourish under those circumstances, which then have flow-on effects to reducing the niche for which the bad bugs can flourish. So I think that's probably, in reality, maybe what I'm most excited about is some of the simple things we'll be able to, with some better evidence, robustly offer and suggest our patients can do.
So yeah, so interesting. And yeah, we give them a lot of dietary information. We worry about like infectious issues with the diet, but I we don't really give them a lot of information on influencing their microbiome. So that sounds like the next frontier, and certainly something that many people, both in medicine and outside of medicine, are really thinking hard about these days. So TTS is really represents international transplantation. What do you think about the impact of microbiome research on, global issues, and what does this mean for like transplant in, India and South Africa, Brazil and Australia? And what does your research in Australia, how does it impact far-reaching areas?
Thanks, Camille. I think the microbiome is for all of us. Um, I think as microbiome analysis strategies and sequencing platforms become cheaper and more accessible, and we're gathering more information about the microbiome, hopefully we'll be able to translate that science into a really simple test that is accessible for everybody. Similar to the way that we might use, a CMV IgG serostatus before transplant or a CMV viral load to stratify patients. We really need that sort of one cheap, easy test that provides a snapshot of the microbiome and its function that is clinically meaningful. I think another really important point is that there is a lot of geographical variation in the microbiome, and we know that race, diet, age, gender, a lot of these factors can influence the composition and structure of the microbiome. And we know there is obviously, in particular, diverse dietary approaches across the globe. So a lot of studies in the microbiome today really have focused on single centers, geographically isolated microbiome observations. But what we really need is sort of international and cross-center collaboration to ensure that the observations that we're making really are translatable and generalizable to the general population. So I think an opportunity like TTS to have those discussions, share experience, and potentially share resources for people who may be simultaneously collecting samples from patients really create the best opportunity for us to sort of identify and translate the science into practice for everybody.
That sounds amazing. I know that your talk is on the Wednesday, sort of near the end of TTS 2026 in Sydney. And I would encourage everyone listening to attend your talk. I know that it's near the end of the conference, but I definitely booked my flights the following day so that I could be there in the front row to cheer you on and to hear all of this super exciting information. I think this is sort of a very exciting frontier. Will really be hopefully game changing in transplantation and really could influence outcomes and not just outcomes of transplant, but hopefully a lot of quality of life and overall health outcomes. Um, and we should encourage anyone listening who hasn't yet submitted an abstract in this area. Are you anticipating any special work in this area, or do you know about others that are submitting work, or is there anything exciting that you're looking forward to for abstract submission before March 19th?
Great. Great question. Thank you, Camille. I'm so excited to see what everyone is bringing to the table here. There are so many great groups looking at this globally. I think I'm really interested to see the breadth of the work in microbiome space, and I think we really need work that spans the preclinical space, where we're really sort of teasing out in controlled environments the mechanism by which our bugs influence our host response, all the way through to translational studies where people are collecting, longitudinal samples rather than just cross-sectional samples from patients undergoing transplantation and comparing across transplant types and geography, which I know are underway. There's some really fantastic groups in Europe undertaking this kind of work. And I think the next frontier is really those that are undertaking interventional studies, trying to translate those observations into the field. So using computational techniques to see how features of the microbiome can predict complications. And maybe we'll even be lucky enough to see some work of those who've been brave enough to undertake interventional studies, modifying the microbiome, whether that's through fecal microbial transplant to try and reduce colonization with multi-drug resistant organisms, or dietary interventions to see if they can improve, the healthy anaerobic species in the gut that might improve complications after transplant. So I expect, and I'm really looking forward to seeing the full breadth of that work at TTS and learning a lot myself.
Sounds wonderful. I can't wait to read the abstracts and then see the all the various presentations, and then most of all see your plenary talk. Very, very exciting that Wednesday near the end of TTS 2026 in Sydney. Can't wait. Thanks a
Thanks,
lot for
Camille.
the chat, and we look forward to seeing all your wonderful work.
Looking forward to seeing you there.